A ventricular septal defect, or VSD, is a hole between the left and right ventricles. This causes blood to flow from the high-pressure left ventricle to the lower-pressure right ventricle during systole. This flow creates a loud, harsh murmur that lasts throughout systole. We call it a holosystolic murmur, because it starts with the first heart sound and goes all the way to the second heart sound, without stopping. You can hear this murmur best at the left lower part of the sternum, usually around the third or fourth intercostal space.